Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Benoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest again this week, Rachael Laudano. She is the Senior Director of ALSA Partnerships and the Interim Director of Assisted Living at Masonicare at Ashlar Village. Welcome, Rachael, and thank you so much for joining us.
Thank you so much for having me.
It's wonderful to have you here today. We've been talking a lot about the slow reopening of our communities. How is that process going for our assisted living residents and their families?
So it's actually going quite well. We're happy because, of course, we have warm, welcoming weather at this time. So, as we have slowly been reopening, we have had our visitation throughout our memory care and, of course, our extended assisted living side. And it has been absolutely fabulous. The residents and their families are enjoying each other. And, of course, the pond side view. So that has been extremely helpful. And, they enjoy their time outside. At this time, the dining services we kind of have inside of their rooms when they're visiting with families. But the residents are, of course, enjoying a slight rotation of the dining services. So a little bit of a mix and match. Some dining is inside of their apartments and some dining is out in our fine dining services. We also have a bistro section. We just opened that up not too long ago, and they have kind of like a grab and go. And I think the residents have really received that well, and they are enjoying it. We also have opened up to, some small shopping trips. So down to the West Side Market, some larger grocery stores, and even our stores on campus over on the Ashlar Village side. So they're very thankful to be getting out and about. And we also have, of course, some of those activities and entertainment. We, of course, are being mindful with some of our, protective ideas, right? So kind of coming across with still wearing the masks and enforcing our masks, encouraging our residents to just remember to be mindful of their social distancing as well. So everyone is doing great over here, and we're so happy to report that, everyone's happy and healthy. So all good stuff.
It's fantastic news. Thank you so much for the update. And JP, it really has been wonderful to witness our residents be reunited with loved ones that they hadn't seen in person in some time.
Absolutely. Up at Ashlar Village, just going up there and going into a meeting is a major step for us. And I was up there for a finance committee meeting, and the residents that were there, they were elated to be able to see us in person and have a meeting, if you will. And that energy is permeating through the campus. The residents, the family members, you can definitely see a different vibe as we continue to come out of this pandemic that, has been extremely challenging for all of us. And Rachael and her staff up at Ashlar Village, we talked about Kim last week, have just done an amazing job in everything that they've done to keep the residents safe, but also keep the residents engaged. And as we continue to see that normalcy come through, the residents, the smiles, the conversations have really changed quite dramatically. And being able to see them sitting in the dining room, being at the Duck Inn, or walking through the campus. Just yesterday, saw a bunch of residents walking, which I haven't really seen too much of, but seeing them walking on our campus is just really reinvigorated, not only, I think, the campus, but also just our staff, where we're seeing what the campus is truly all about each and every day. So it's definitely a very positive time for us moving forward.
It's wonderful news. Switching to current medical news, Dr. Schwartz, the The number of vaccinated adults across the country continues to rise, which is a wonderful thing, but we're still seeing a strong number of COVID cases every week. Where do we stand at this point?
Sandy, every time we do these shows, there's always something to talk about regarding COVID. And I'll get to that in a second, but I wanted to share with JP to welcome Rachael, and it's been great to work with you on the coronavirus task force, and just to see, how hard you've worked to enhance the quality of all the residents' lives. And it's great to see things reopening, and I agree, seeing people taking walks, just enjoying life again,
Mm-hmm. Thank you so much.
So once again, I thank Sandy because she's helped me find a nice article that kind of summarizes some really good points. And a lot of this I have to read because it's just too much for me to memorize, but hopefully it'll cover some really good points. It's like a two-part article. And the first part kind of talks about, it's a lot of data and statistics about where we stand as a country, and state by state a little bit, as far as vaccinations go. And then the second part really kind of gives you an update as to where we are now as far as, COVID cases that are emerging, and unfortunately even talking about deaths. But so let me just give you the title of the article, and it says, half of US states have fully vaccinated at least 50% of adults. We need to keep going to prevent future outbreaks. So, essentially what's said from the CDC, and they made some announcements last Sunday, they said at least 25 states plus Washington, DC have now fully vaccinated at least half of their adults. And I'm going to read these states quickly in case some of you are interested in knowing which states they are. There are 25 states. I'm going to do it very quickly, but Alaska, California, Colorado, Connecticut, Delaware, Hawaii, Iowa, Maine, Maryland, Massachusetts, Michigan, Minnesota, Nebraska, New Hampshire, New Jersey, New Mexico, New York, Oregon, Pennsylvania, Rhode Island, South Dakota, Vermont, Virginia, Washington State, and Wisconsin. So that's quite a few when you see the data. But the state, you could take a guess before I tell you, but what do you think the state with the highest proportion of adults that have been fully vaccinated is? It's actually Maine. And Maine has more than 62% of people 18 and over that have completed their shots. So here's some more data that I'm just going to kind of read to you. So it says across the United States, roughly 61.3% of American adults have received at least one COVID-19 vaccine dose, and about 49.6% are fully vaccinated. And this is according to CDC data. And they also say that more than 49% of the country's total population has gotten at least one shot, while more than 39% of the population is fully vaccinated. Again, that's CDC data. So what do they say ultimately is that the impact of the vaccines is now obvious. The country is recording some of the lowest COVID-19 metrics in roughly a year, and officials say could get even better than that. So that shows you the impact of vaccinations and how well we're doing. But now let's look a little more closely as to how many COVID cases the United States is averaging. So this is some data from the Johns Hopkins University, and they say in the past week, the US has averaged more than 25,000 new cases and more than 540 new COVID-19 deaths daily. So that's still something to take seriously and to realize we're not out of the woods yet. But what they do say is we're way down from where we used to be just weeks ago. The country's average of daily COVID-19 cases in the past week is down by 57% from where we were just a month ago. Again, this is Johns Hopkins data. And they say the 7-day average of daily COVID-19 deaths is down by 23% from a month ago. So this is a quote from Dr. Scott Gottlieb. And if you don't know who he was the former Food and Drug Administration commissioner. And what he said is the people who are getting infected now tend to be people who are younger, less vulnerable to the infection, because a lot of the vulnerable population has been vaccinated. So the final data here is more than 85% of Americans 65 and older have received at least one COVID-19 shot, and nearly 74% are fully vaccinated. This is CDC data, so that's pretty impressive. And the final comment that was made is, since there's no vaccine for children under 12, the American Academy of Pediatrics said last week that children and adults who are not yet fully vaccinated against COVID-19 still need to wear masks in certain settings. So I think the take-home message from all of this is the vaccines are working, they're effective, they're moving us along, and Rachel kind of explained how well things are going for the residents ultimately, and we still need to be diligent. We still need to have good infection control practices, and every week, Rachel, since you may be new to this program, I try to give an inspirational quote that kind of helps us along. It certainly helps me. And this one actually came from Masonic Home Health and Hospice. So last week I was sitting in a team meeting, hospice team meeting, and Karen Garley actually brought me a bottle of water. And on the bottle of water was attached this little message, which I'm going to read to you. And the message says, even the smallest act of caring for another person is like a drop of water. It will make ripples throughout the entire pond. And this was said by Brian Mateo. And the best I could find is that he writes a lot of inspirational quotes and inspirational sayings, but it really echoes how much I appreciate everyone's hard work and caring, and Rachel, everything you do for all the residents. And again, it does have a ripple effect, and things are getting better and better. So again, I just want to thank everybody for all their dedication and hard work, and once again, wish you health and wish you peace. Thank you.
Thank you, Dr. Schwartz. Such a wonderful quote, and we're all happy to be part of that ripple effect at Masonicare. Well, we thank you all so much for sharing your time and your insights with us today, and we thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe and stay well.